to London, and we have with us an amazing speaker who's going to share his knowledge on COVID-19, Professor Bhik Kotecha. So are you with us so that just we can get a hello from you?
Hi, namaste.
Okay, yeah, global namaste to you, Dr. Kotecha. Lovely. Before we start, we'd love to give you an introduction so that the viewers and the audience know who they're listening to. Dr. Kotecha actually graduated from Cardiff in 1984 and started his training in the ENT, ear, nose and throat in Manchester as a senior house officer and a registrar. He then moved to Sussex University to complete his thesis in ototoxicity before joining the Royal National Throat, Nose and Ear Hospital as a senior registrar. Professor Kotecha was appointed as an ENT consultant in 1995 and have helped in establishing the sleep disorder unit at that hospital. In 2004, they were awarded the Hospital Doctor Team of the Year Award for Sleep Medicine. Professor Kotecha is an examiner for the MRCS at the Royal College of Surgeons of England and an assistant editor for the Journal of Laryngology and Otology. He is the immediate past president of the Sleep Medicine section at the Royal Society of Medicine, and this has been going on from 2009 to 2011. Here we have a very academic personality who's going to be sharing his knowledge on this platform on healing our earth on today's topic, COVID-19. So, Professor Kotecha, a global namaste and a warm welcome to you on behalf of the Healing Our Earth community. Welcome, and the stage is all yours now.
Thank you very much, Dr. Soda. A global namaste to all the viewers. And I'd like to thank Healing Our Earth Organization Committee for allowing me to participate and share my views on COVID-19 and BAME. I would like to do a PowerPoint presentation, so I hope that I'm sharing my screen with you now.
At the moment, we can't see this screen share, but if you go ahead and share the screen, let's see what the IT department is. They will be assisting us in doing that.
So
Great.
Can you see my screen?
Absolutely, we can. Thank you very much.
Okay. So you may be wondering, why is this ENT consultant who deals with ear, nose and throat problems going to talk about COVID-19 and BAME? Well, as Dr. Soda mentioned earlier on, and Mr. Palan mentioned earlier on, that life became very different from the third week of March when we went into lockdown. And I was equally affected because I was not doing any elective ENT surgical procedures or indeed any clinics. At that time, it became apparent that this COVID-19 is here to stay, and it's affecting specifically the BAME community a lot more than what one would expect. And as a result, that instigated my interest in looking at BAME and to really look at this in greater detail, and I'll continue to do that. So I'd like to share some of my thoughts and vision about what happens between COVID-19 infections and the BAME community. COVID-19 is a global problem, and as of yesterday, approximately 13 million cases of COVID infection have been reported worldwide, and more than 500,000 deaths. This is a huge amount, and even if you look at UK as a country, we've had more than 44,000 deaths, and in the last 24 hours, 148 deaths were reported, which means it is still here and not gone. Now, although our infection rates are not as high as others, our death rates in the UK are a lot higher than expected. So we are losing something like 657 people per million population. And this is the second highest death rate compared to the rest of the world, and Belgium is above us. However, when you look at the infection rate worldwide, United States comes top of the list with more than 3 million. India is not that far off with 821,000. And although UK is down the order at about position number 8, in terms of the death rate, it's the third highest. But what I must emphasize that no race or country is exempt for this dreadful virus. Now, when you want to talk about BAME, it makes you think historically about great celebrities like Mahatma Gandhi, Nelson Mandela, Martin Luther King, who were talking about dealing with ways in which to reduce the amount of race discrimination and segregation in the world. It's interesting how these leaders have fought hard and tried to express to the world that there should be equality everywhere. Now, just from a personal perspective, I was in my clinic a few months ago. This was before the COVID came into being. And I had a 4-year-old child who is white in origin with his grandmother sitting in my clinic. And it was fascinating to hear what the grandmother said to me about this child when they were on holiday in the Caribbean. This young white kid was by the swimming pool, and he saw a 4-year-old or a 5-year-old black kid falling and bruising his knee and started to bleed. And he said to his nanny, "Nanny, isn't it interesting that that young lad there has got black skin, I've got white skin, yet our blood is the same color, it's red." So if a child who's 4 or 5 can understand this equality issue and the similarity in human beings, why can't adults? So what does BAME mean? It does not relate to country of origin per se, but the BAME acronym stands for Blacks, Asians, and Minority Ethnic Communities. The white ethnics, on the other hand, could include white British, Irish, Scottish, and other whites from the rest of Europe. If you look at the global percentage of BAME population, obviously, when you look at India, there's not that many other blacks or other ethnic communities. But if you look at Australia, for example, that accounts for 30%. The BAME population accounts for 30% of the whole population. In America, 39% are blacks, Hispanics, and Asians. In Canada, about 10%. In UK, 20%. What one must remember, however, that in spite of Australia having, say, 30% BAME population, it is a very sparsely populated, and it's very different in terms of its immigration type. So immigration laws are different, allowing for very highly qualified people to enter the country. And so for this reason, the demography and the epidemiology may be different in different continents. Looking at BAME in the American continent, it is estimated by 2045 in the United States, the white will be in minority. So the BAME population is increasing all the time. So what about in the UK, where are we based, or where I'm based? Well, again, the BAME is on increase. This community is on the increase, and it may be because of global events that has occurred historically. So for example, during the Windrush era in 1948, 500 migrants came from Caribbean to Essex, and this has continued to 73. Similarly, with the Eastern African exodus in 1969 and the expulsions of the Ugandan nations in 1972 made UK more densely populated with the BAME community. Now, obviously, these individuals are coming here for betterment of life, education, lifestyle, and prospects is what they've got in mind. Looking at the UK population now, 52 million in 1960, and it's estimated by 2020 is going to be 67.8 million. And amongst this, the ethnic population is also in the increase. So for example, in 2011, according to the census data, 18.1% of the population was of ethnic origin. But in 2018, this increased to 19.5%, and specifically in London, 44% is the BAME community, compared to what it was in 2015, 28.9%. Looking at the demographic data and the geographic distribution, this slide demonstrates that London is very densely populated with the BAME community, here accounting for quite large number. Likewise, the West Midlands, the Yorkshire and Hull and East Midlands are similarly populated with the BAME population. Now looking at deaths and the coronavirus in the population in the UK. And in about April or May, when about 23,000 people had died, it was apparent that the population, the proportion of people dying was very similar to what was expected. But when they looked at the predicted impact of coronavirus on the BAME community in particular, and they looked at the predicted adjusted for age and location group as opposed to the actual hospital death. So the yellow represents the actual hospital death due to coronavirus, and the blue as to what was being predicted. You can see that in the Pakistani population, it was more than what was expected. Similarly, in the Indian, in the Black and the Caribbean, it was nearly 3 or 4 times the white British population, and similarly in the Bangladeshi. It was interesting to note that the Chinese female population were not as badly affected. So it was the Public Health of England that noted this disproportionate impact on the BAME group, and particularly in April in the United Kingdom, when they looked at the critically ill people, 34% or more than a third were from the BAME community. And there was a disproportionate frontline workers affected. This was thought to be a lot of different factors, and there were multiple family members, specifically in the pharmacist and the medical profession, where a lot of the family members were in the same profession, and because of the extended families, a large number of infections and deaths were seen. The data from the Department of Health in 2019 revealed that more than 1.2 million NHS employees are working for this front line, of which 80% are white and 20% were from the BAME community. Of this, 10% were Asian, 6% were blacks. However, when you look at the medical staffing, 30% of the medical staffing in the UK is the Asian community and 55% white. Whereas the non-medical, it's only 19% that is non-white. So here's a collage of unfortunate events that has happened during the COVID era and the BAME healthcare staff which have sadly lost their lives. And with this respect, I want to pay a special tribute to ENT consultant colleague of mine who worked in Burton, but unfortunately died in Leicester Royal Infirmary. And this was after having treated a patient with a throat infection who was COVID positive. Looking at the geographical distribution, we can see that London, in terms of frontline health workers, was the highest. And this raises a point of the demographic data, especially with the second lockdown in Leicester, where there is environmental and behavioral factors coming into play. So looking at the COVID deaths, particularly in the NHS frontline, it was astonishing to see that the BAME staff had 62% of the death rates of the 166 people who died. 62% were from the BAME community, compared to only 20% that is the NHS workforce in general. So why is it? Why is the BAME population so prone to being affected by the COVID virus? This is a very complex, multifactorial event, really, because you've got social factors, cultural factors, behavioral issues, economical, inherent genetic factors. And is it because it's a differential exposure or an increased vulnerability of these individuals that is causing this large number of people to be affected and dying? Now, I'm sorry this slide is a little bit busy, but it actually lists all of the factors that could be possibly contributing to this. And this includes employment, where this may be low-paid workers or insecure employment or high-risk workers, professions such as the NHS workers, the pharmacy, the retail shop, transport drivers, and maybe that this is an overrepresentation of the ethnic groups in bus drivers and taxi drivers particularly. Maybe it's the extended family, the culture, and maybe people living in the more deprived areas. Perhaps there's an impact of the poor diet and the low rate of exercise and in general an unhealthy lifestyle. And perhaps there's a lower level of health literacy, and maybe there's a weaker immune system compared to the more affluent group who are better, well-to-do and better fed and more aware of the health issues. What about the inherent factors? Well, one of the things that has been very popular in the media, and it's been covered quite adequately, is vitamin D, or absorption of sunlight. And this is an interesting thing because, in the BAME community, the dark skin, which sometimes has an advantage, for example, if you look at skin cancer, people with dark skin have got this protective element of not getting skin cancer. However, the absorption of sunlight is conversely not so, because the dark pigmented skin is not as good as absorbing the sunlight and creating the metabolites, which the fair skin is used to. Perhaps there are genetic factors, and this was mentioned earlier on, there's the higher incidence of obesity, diabetes, and cardiovascular problems. Perhaps in general, the BAME community has a weaker immune system. Now, at this stage, I'd like to acknowledge some of the work done by the South Asian Health Foundation. And if anybody's interested, I would strongly recommend to visit their website and to read one of the latest reports on COVID-19 and BAME. In particular, I'd like to acknowledge Professor Kiran Patel, who is a consultant in cardiology and the Chief Medical Officer at the Coventry University Hospital, who founded the South Asian Health Foundation and has acquired a lot of momentum in this organization and is contributing a lot recently towards COVID and BAME, and the recent report on COVID and BAME, which I'd like to share with you in the next 2 slides. They have looked at a variety of factors and proposed immediate actions to prevent increased incidence of disease and further health inequality in relation to this. So they've said that there should be culturally tailored public health messaging. So there's a lot of language barriers in certain areas, and maybe this should be overcome. Perhaps there should be a tailored testing, tracing, and isolation strategy, and the priority for the BAME workers to be tested should be highlighted. They've looked at ensuring that there's higher research quality and equality, and in taking measures to protect the migrants. We've always relied on scientific data, and they've specifically concluded that the science data has to be strengthened and the scientific perspective has to be looked at in greater detail. In terms of long-term actions to reduce the structural inequality, they've specifically emphasized that the health inequality should be reduced. They've suggested looking at addressing occupational inequality, looking at social and housing inequality, looking at differential educational achievements, looking at discrimination, which is still there in the NHS, and in general, improving health literacy and knowledge relating to lifestyle behaviors. So when looking at cultural and religious activities in the BAME community, particularly the Asians, if you look at Asians' weddings, if you look at the places of worship like temples and Gurudwara, religious festivals like Diwali, Navratri, Holi, Baisakhi, just to name a few, you would appreciate that these are huge events which include a lot of people getting together, and hence the chances of spreading infection like COVID is exceptionally high. Look at this slide. On the left, you see Navratri festivals in one of the centers in the UK, but on the right, you see places like Ahmedabad where they've got tens of thousands of people getting together. Now, perhaps in the fear of the second spike of coronavirus not far from us, we have to be very cautious about these forthcoming festivals. We've got Navratri and Diwali coming, and this is going to be a very different scenario as is other things like travel, which Mr. Palan alluded to earlier on. So to conclude, ladies and gentlemen, there's no doubt that there's an increased incidence in the BAME community. There's no doubt there are multiple factors, various factors, but are there correctable measures for the second pandemic? Yes, there are. The Public Health England is encouraging faith leaders and community leaders to talk to the communities individually, to link up with Public Health England and help them understand what the problems are and how to overcome them. And a personal plea for you guys, we have got a COVID-19 questionnaire, which is on the website lcnl.org/survey. And if you know anybody from the BAME community who has been affected, they could go and log on to this website and fill in the questionnaire for us to understand this better and to help the medical fraternity with this and to help our community in future pandemics to overcome the problems that we are facing now. I've been assured by Healing Our Earth Organization Committee that the lcnl.org survey will be available on the Healing Our Earth website in the very near future. And so this will include a more global audience rather than a more local community that I targeted in the very first instance. I would like to thank you all for your attention. I would like to say to you, keep healthy, stay alive, and a global namaste to all of you. Thank you very much, and over to you, Dr. Soda.
Thank you very much, Professor Kotecha. Thank you for enlightening us with such amazing statistics that you have come up with the BAME community and all the hard work that everybody's been doing to help the community and to people at large. So thank you very much for that. Just a quick couple questions. You discussed a little bit about the South Asian Health Foundation. their main purpose of creating this organization is to help identify why the BAME community and what can be done. Do we have any information on that?
So the South Asian Health Foundation was founded originally in 1999 by Professor Kiran Patel. And at that stage, the aim was to look at the South Asian population in the United Kingdom who were suffering more frequently or more commonly with diabetes, with cardiovascular problems and obesity. So in general, it's a health foundation. So they're looking at health issues or health related issues. But because of the recent events of coronavirus and COVID-19, they've taken more effort, they put more effort into this to look at the BAME community in particular and created a report to highlight the multifactorial aspect of the community in general, ranging from socio-economical status to cultural behavioral issues and how those can be changed in order for us not to be affected so much.
Great. Yeah, I think they're doing some amazing work out there with the South Asian Health Foundation.
Absolutely.
Which is really good. Now, a personal question to ask would be, you being a person who is in physical contact with patients, treating them, doing surgeries, what kind of precautions do you as a surgeon have to take when you are with your patients?
So that's a very important and a very pertinent question, Lalit. You know, when the COVID crisis first started, we were not taking this very seriously and we were lacking in PPEs. This is the personal protective equipment. So now as an ENT surgeon, when I'm examining a person's nose and his throat, these procedures are regarded as aerosol generating procedures, so they can spread the infection very rapidly and very quickly into the surgeons. So we have to wear an FFP3 mask, and then on top of that we have a visor, we have a full surgical gown, so we protect ourselves, and the rooms where we examine these patients have to be specifically ventilated to make sure that there's adequate ventilation, and after completing the exams, we have to ventilate this room and vacate the room and have it deep cleaned before we examine the second patient. So we take huge care and precautions in order to make sure that we reduce the chances of spreading this infection.
Obviously, that takes a fair bit of time, but it's obviously for the safety of both yourself and the public at large.
Absolutely. So if I compare to my work, what I was doing, say in January and February compared to what I'm doing now, I think in the same amount of time, I'm probably doing about 30% of the work that I used to do. So although it's time consuming, the safety is of utmost importance, and that is what you have to address.
Yes, yes, absolutely correct, Professor Kotecha. Now, before we leave you, we'd love to hear something very, I'd love to hear some 3 tips. As an ENT surgeon, in this current COVID climate, you can give 3 tips on how to tackle this challenge from a medical perspective, or just as a well-being individual, academic individual. What would you advise the general public to do?
Well, I think as some of the previous speakers have alluded to, and I think I would share that with them, that look, you've got to be sensible about this. So social distancing is what has been always emphasized. You need to do that. Regular hand washing, and I'm sure when you see my colleague, Dr. Bharat Pankania, he will labor that point again. The hand washing is very important. I think taking general precautionary measures, general hygiene measures are important. Improving your immunity is also important. So I think in terms of social distancing, and that's fine, but your general health, and our previous speakers had mentioned how to improve your immune system. I think that's very important, with adequate sleep, hydration, well-nourished diet, and those are the important things. It's a common sense approach, but it's quite often very easy to forget this common sense approach, and then you increase the risk of acquiring and passing the infections.
Yeah, no, that's very good information being shared. And one final question: when do you see this pandemic ending?
Well,
Will it?
There's been a debate about the production of the vaccine, and vaccine is very eagerly awaited, but we do not have this available in the very foreseeable future. So I think, like Mr. Palan earlier mentioned, maybe 2021. So I think 2020 seems to be completely taken over by COVID. So I would say perhaps another 6 months or 12 months before we get to some degree of normality. But what I see happening is that we'll have what we call a new normal. It's going to be very different to what we've been accustomed to. And this is something that all of us will have to get used to.
Great. Thank you very much for sharing that valuable information and amazing statistics that you had on your slide, Professor Kotecha. Thank you for sharing that. Those figures mean a lot. There's a lot of research that has been done, and I'm sure more work is being done with the BAME community and COVID-19, and we really look forward to listening to more updates. As you all are aware, I just wanted to make sure that the global audience is aware this is a monthly seminar that will be hosted by Healing Our Earth community on current updates on COVID-19. So I think this kind of information, this kind of statistics will be very, very valuable moving forward. So thank you very much on behalf of the Healing Our Earth community, Professor Kotecha. Thank you for your valuable time.